Thanks so much for everybody to be with us today. I wanted to let you know how we're going to go through this webinar tonight. We are addressing the business impact of COVID-19, which means that's human resources, legal, insurance, and financial aspects of it. For those of you who are interested in particular, and I know many people are, in the safety and the infection control aspects of safeguarding your practice, your patients, and your dental team, there will be a webinar that is an on-demand webinar from the American Dental Association that addresses all those topics on Friday. So you should be able to go to ada.org/virus, and you will be able to watch that whenever you have the time to do so. So let me ask you, let me introduce to you our panelists for tonight. We have Jody Schaefer from HRMS talking upon HR issues, Dan Schulte of Kerr Russell on legal issues, Craig Start of MDA Insurance on our insurance issues, and Ted Schuman from DBS Investment Advisors on financial issues. We also have President Margaret Gingrich available to answer any questions as always. I want you to recognize that all information that is being provided today is up to date as of today, March 18th. This is an extremely rapidly evolving situation. New information is coming out every day. So we will be keeping you updated on the MDA website, and we also recommend that you check the ADA website and the CDC for those clinical aspects. Any information that you gain today is for general information. It really doesn't substitute for advice from your own professional advisors. So I see that we have at least 33 people who have learned already how to use the Q&A function to ask questions. So that is exactly right. We're going to have each person do their presentation, and then we should have plenty of time for Q&A at the end of the program. So if you will enter your questions as you go through it and as you think of them, after Mr. Schuman has presented, then we will go ahead and start to select some of the questions to answer for you. Now, one thing you should note, we're probably not going to be able to answer lots of very specific individual questions about you and your practice. So we are going to be going back out afterwards with some of the more frequently asked questions for more information. And of course, you can always call us with specific questions at an individual basis at a later time. So let's go ahead and get started. It's my pleasure now to introduce you to Jody Schaefer, and she'll be talking about the HR aspects. Jody?
Thanks. I just wanted to make sure that you can all hear me. Can you hear me okay? Okay. So as Karen had said, this information is changing daily, and actually just a few hours prior to us going live with this webinar, the Senate passed the House bill, and we're now waiting for it to go to the President's desk for signature. And so that's a whole new can of worms that we weren't necessarily prepared to speak about this evening. But certainly a lot of questions are going to be raised regarding that stimulus package and the stimulus package the President's talking about that's supposed to follow this most recent one. And all of those will have an impact on your business. And so there will most likely be subsequent resources, whether in the form of a webinar, articles, FAQs, links to just keep you abreast of that. But tonight, we're really going to spend more time talking about what we know currently. And since that bill has not yet been signed and we haven't had a chance to thoroughly go through it, I'm not going to spend a lot of time on that particular aspect. Instead, what I am going to spend time on is what I've been getting inundated with since Monday, which are questions around unemployment. So, as you all know, the MDA came out with some guidance to their members, asking them to close their businesses to things that are non-essential or non-emergency for a period of 2 weeks. And for many practices, that means that your staff are now applying for unemployment benefits. And for some of you, it's for the very first time. And you're not sure how that unemployment system works. You're not sure what changes have been made to the system as a result of this most recent executive order. And so what I thought I would do, just given my allotment of time tonight, is give you some background information on how unemployment works, and then some of the things that have changed. And I think that in doing so, I'll be able to answer probably 80% of the general questions I've been getting, and then certainly more specific questions we can get to if I've still got time in my session or else at the end of the webinar. So what I'd like to do is just share my screen with you. I've put together a couple of slides, and I think this will be helpful for folks that like to be able to read as well as listen. So hold on one second here. I'm going to just share. And this is the one I want to share. Okay, can you all see what's on the screen here? Okay, so what I wanted to do was start by just talking to you a little bit about how the unemployment system worked historically. And when I say historically, I mean as of Sunday, okay, March 15th of this year. And then I'm going to show you in the next slide what's changing or what has changed as a result of the executive order that came out on Monday. So historically, if a worker became unemployed, so out of work, even if it was temporarily, or underemployed, meaning their hours were cut, again, even temporarily, and they were in this situation through no fault of their own, then they could file a claim with the Unemployment Insurance Agency. And they had about 14 days from their last date of work or from the date that their schedule was cut in order to make that claim. Once a claim was made, the Unemployment Insurance Agency would determine whether or not that individual was eligible for benefits. And this is a two-pronged test. So the first thing they look at is how much money that employee earned from all employers combined over the last 4 quarters. And there's a whole calculation that the Unemployment Insurance Agency, and I'm going to refer to them as UIA for short, there's a whole calculation that the UIA uses to determine whether or not you've earned enough money to establish a benefit year. In other words, to open a claim. If it's determined that you've earned enough money in the last 4 quarters to establish a benefit year, then the next prong in that process is to determine why you are out of work and is it truly through no fault of your own. So this is the point where you, the employer, would typically get paperwork from the Unemployment Insurance Agency alerting you that someone has filed a claim, and then it would ask you if there was any sort of disqualifying reason that would prevent this claimant from receiving benefits. And the turnaround time from the time the person filed the claim to the time unemployment received that response back from the employer was roughly 2 weeks. So it would take a while for some of these claims to initially get approved and then paid out to the claimant. And at that point, they would then backdate that first payment to the date that the claim was initially made. The claimants, in order to receive those benefits, had to be ready, willing, and able to work. And they had to be actively seeking work. And they had to prove to the UIA that they were actively seeking work. And one of the ways they did this is that your staff would have to register in person at the local Michigan Works office and then fill out some work search requirements. And if they did so, then they would receive benefits. There was a caveat to that. If an employer was going to be temporarily closing down and they anticipated hiring that employee back or reinstating their work schedule back to what it was previously, and they were going to do so within 45 days, then they could alert UIA that this was just a temporary shutdown, and UIA would then waive those work search requirements for staff in order to get benefits. So all of this would happen assuming that the benefit is qualified and they're eligible and they're proving that they're ready, willing, and able to work. Then those unemployment payments would start coming to them. Claimants typically would call in through a phone system or online every 2 weeks and answer a series of questions about whether or not they were still unemployed and did they receive any earnings in the past 2-week period of time, etc. And once the claimant certified that they were in fact still unemployed or they were still in need of these benefits, then that benefit payment would be made. And it's typically made via direct deposit, and those are made weekly. And then the cost of those benefits would be charged back to the employer's account. And if an employer had a lot of people drawing unemployment from them over a series of years, then their experience rating may go up, kind of like how work comp works. And so those employers might be paying more in terms of their unemployment taxes through the payroll tax. The maximum amount that a claimant could receive in a given week for unemployment benefits is $362. And the maximum number of weeks they could obtain benefits for is 20 weeks. So this is how the system worked up until Sunday. Now I want to share with you what's changed. So let me move to that screen. So as of Monday, the governor put forth an executive order, and she expanded unemployment benefits and eligibility. And so what I have in red here is the information that has changed. So I copied the previous slide, and then I made the edits in red. So as of Monday, and this is true up until April 14th of this year, so this is for a limited window of time. One of the things that changed as a result of the executive order is that unemployed or underemployed claimants could file benefits for additional reasons beyond just being out of work through no fault of their own. Those additional reasons now include if they are sick, related to COVID or coronavirus, caring for someone who's sick, again, related to COVID or coronavirus, in quarantine or self-isolation, and or taking care of children due to the executive order that closed schools in our state. So it expanded the reasons that people could now establish a claim. Another thing it did was it gave claimants a longer period of time in which to apply for unemployment. Previously, it was 14 days. It's been extended to 28 days. This is important for your staff to know because the unemployment website was crashing over and over again today because of the increased traffic as people were rushing to get their claims in. And so claims will be honored up to 28 days out. Another thing that changed as you kind of read through this is that hopefully the turnaround time to process these initial claims will decrease. Typically speaking, it takes about 2 weeks or so before the first payment is made. The hope is that with some of the changes to the application process, this turnaround time will decrease and be much closer to 1 week. Another thing that changed is, I said before, claimants had to be ready, willing, and able to work. Well, with the expansion of coverage to folks who are sick, that able to work piece is no longer applicable in all circumstances. Another change is that folks no longer have to now register in person at the local Michigan Works office to prove that they are seeking work. And this is part of the social distancing and UIA not wanting to have people coming into office settings. So they're letting folks just apply for unemployment online, and they are accepting that application as proof that they are registered and seeking work. Again, there's still the caveat that allows an employer to notify UIA that they intend to be closed only temporarily, or that they have adjusted this worker's schedule only temporarily and therefore is asking UIA to waive those work search requirements. So that's still an option, and I've sent out some information to many of you on where to find that form, but you would log into your employer account through the unemployment website, your MyWham account, and the waiver is at that point. Another change is that benefits typically, right, when an employee or an ex-employee files for unemployment and they are granted benefits, it is the employer whose account is charged for those benefits. And there's been some confusion around this. So earlier on in the week, it was thought that the executive order said, look, if you have to close down or if your business is affected because of COVID-19 or coronavirus, then your accounts are not going to be charged. It was later clarified that what the actual language said is that unless your employees become unemployed because your business was specifically called out in that executive order, then you will not be charged. So right now, dental practices, while advised by the MDA and the ADA perhaps to close, dental practices were not specifically called out. in the executive order on Monday. And so as of now, those accounts, for all of you listening, if you've got staff that are claiming unemployment benefits, as of now, UIA may be charging those benefits to your account. Now, there is heavy lobbying going on at the state level to get the governor to include additional exceptions to that rule or include other industries in her executive order. And we're hopeful that that will happen before you feel any real financial impact on this. But just want to give you the information, as I said, as of now.
Jody, can I interrupt you momentarily?
Yeah.
We're showing your slide, not the slideshow view here, so we're seeing your extra slides on the side, and it's not taking up the whole screen. If that's deliberate, I will go away, but otherwise, we've had a few people on the Q&A say, hey, can we get rid of those slides?
We can, but I don't know how to, let me try this. I'm not sure.
Yeah, if you go to the, here where it says slideshow.
Right there.
You got it.
Okay, perfect. Sorry about that, you guys. I'm on the final bullet, just talking about things that have changed. Another thing that's changed is eligibility in terms of the number of weeks that benefits will be granted for. For any claims that are filed between this March 16th, so Monday, and this April 14th window, those claims could be eligible for a maximum of 26 weeks of benefits versus the prior 20 weeks. But I have seen no change to the maximum dollar amount that somebody would be eligible for, which is $362 a week. So that's a little bit about how the system works and how it's changed. I want to just make a couple of other points here before I pass the baton over to Dan. There is such a thing in Michigan's system as underemployment. And I said earlier, if you're out of work through no fault of your own, or if your schedule has been significantly reduced through no fault of your own. So in Michigan's system, there is a scenario where a person could file for unemployment benefits and receive payment from an employer either periodically throughout the time in which they're filing for unemployment benefits, or a one-time payment because maybe you're going to pay out 2 weeks of sick leave or something like that. What the claimant needs to do, the employee needs to do, is that, remember I said in order to even get paid, they have to call in or go online every 2 weeks and certify that they're still in need of those benefits. One of the questions that they will be asked every time they certify is, did they receive any earnings or wages during this 2-week period for which they're certifying? They would answer yes, and then they would answer the amount of those wages. And I have down here, and this is on the unemployment website, and I can happily share all this with you to my slides so that you can kind of see the scenarios here. But unemployment gives a couple of scenarios where it shows you the calculation it does. Basically, what they do is they say, look, if you're earning additional money, either because you're getting paid out a severance, you're getting paid some PTO or vacation time, you're getting paid because your employer had an emergency case and they called you to come into work for one day, you can still get those payments, but you have to tell us how much they're for. And if the dollar amount of those payments is more than 1.5 times what we were going to pay you for this week in unemployment, then you're not going to get unemployment on top of it. But if what you received in wages is less than 1.5 times the amount we were going to pay you, then we will pay you all or a portion of what we had intended to pay you in the first place. And again, there's a whole calculation for this. So you can kind of see 2 different scenarios here. And I'll send these out so you can see it. So I'm getting a lot of questions of, can I pay my employees additional money to help offset what they're going to get in unemployment? Yes, but if you pay them too much, it's going to make unemployment go away altogether because they're going to have to claim those dollars. So it's a really sticky situation for employers who are trying to do the right thing by staff, but could inadvertently jeopardize an employee's eligibility for benefits in a given week if what you're paying them is more than 1.5 times their weekly benefit amount. So one point there, and then I'm going to end with this on work share. Unemployment is doing some webinars right now, and one of the things that they're really pushing is this work-share program. Work-share is different from underemployment. So the system I just described to you, where you can have some intermittent pay from an employer and then supplement with unemployment benefits. Work-share is a totally different program. It's a formal program that your employer would set up in advance with the unemployment insurance agency. You have to be considered a full-time employee in order to participate in this program. Of course, the employer defines what full-time means in their practice, and it allows for a more predictable reduction in work hours. And what it does is if an employee's schedule is going to be reduced from by 15 to 45%, so a half a day up to 2.5 days a week on an ongoing basis, then that employer could work with unemployment insurance agency to set up this program, and it would allow the employee to get a percentage of their weekly unemployment benefit amount to help supplement for the wages that they're not getting because of the reduction in their work schedule. There are some perks to employers, there are some perks to employees here, but this is a whole separate formal program, something that you may want to consider, employers who are listening to this, as, you know, if this shutdown lasts longer than 2 weeks, if this starts going closer to 4 weeks or 6 weeks, and we're going to have to phase in kind of that ramp up period when we're all back to work, and you're going to want to do it in a more structured way, then maybe work-share is something that you look at that point. It's not necessarily going to help those of you who right now have staff that as of Monday, you know, left work because you shut down, right? There's no time to go back and then implement this work-share retroactively. But going forward, it might be something worth considering. So with that, I'm going to just hand this over to Dan for the legal side, and then I'm hopeful that I have some time at the end for Q&A to talk about some creative things that practices are doing to help their staff get through these times, in addition or maybe instead of unemployment.
Take it away, Dan.
Thank you. I'm going to address some issues that I've been asked about many times during the last 2 weeks. The first is an employee's obligation to work. Nothing has happened that changes the fundamental nature of the employer-employee relationship. We're hearing that employees do not want to work because they fear exposure to the virus and may be protesting by refusing to work as scheduled or threatening to do so. All employees have an obligation to work as scheduled. If they do not, they can be disciplined up to and including termination in accordance with your employer discipline policies. The second issue is the employer's obligation to pay employees who are off temporarily. Hourly employees must only be paid for the hours they actually work. So an employer does not have an obligation to pay an hourly employee that is off temporarily unless the employee elects to use paid time off. Salaried employees must be paid a week's pay for any week in which they perform any work. So even if one day or part of a day is worked by a salaried employee, they must be paid for that entire work week. If a salaried employee does not work any part of a week, the employer is not obligated to pay them. Like hourly employees, a salaried employee not working at all may elect to use paid time off to keep getting paid. In either case, whether it's an hourly employee or a salaried employee, it's important to note that the employer cannot require the employee to use paid time off unless the employer has an existing policy allowing it to do so. It wouldn't be recommended to rush out tonight and put into effect a policy tomorrow morning requiring employees to do so I would only recommend that you enforce such an existing policy that is already a part of your policy manual. The next issue involves how the employer should react when an employee has tested positive for the COVID-19 virus, has been in contact with someone who has tested positive for the virus, or has symptoms and suspects they may have the virus. In these situations, OSHA and CDC guidance recommends employers take the following precautions. First, ask the affected employee to leave the office and encourage him or her to seek medical attention or self-quarantine. And second, obtain a list of other employees the affected person interacted with in the preceding 14 days and encourage those employees to self-quarantine for 14 days. The employer should notify employees of the suspected or confirmed case of the COVID-19 virus in the office. However, due to HIPAA and other privacy laws, an employer cannot mention the name of the affected employee. OSHA regulations contain a record-keeping requirement that requires employers to make a record of employees who miss work in certain situations. OSHA has clarified recently that COVID-19 cases must be recorded. Finally, and hopefully this goes without saying, an employer with knowledge that the office has been visited by someone with the COVID-19 virus should have the office disinfected, especially the areas known to have been in contact with the infected person. The next issue concerns an employer's liability for claims of an employee alleging he or she contracted the COVID-19 virus while working for you. An employee's claim may be brought under OSHA's general duty clause, or it could be for ordinary negligence. In either case, the success or failure of any such claim cannot be predicted, and it will depend on several factors, including whether the employer has liability. This would depend on whether the risk of infection was a reasonably foreseeable event given all of the facts and circumstances. What preventative measures were or could have been taken? What information was given to the employee? What consents were obtained from the employee? What screening of patients was being performed? And what information was being obtained from patients before the determination was made that they could be safely treated? What physical patient systems were or should have been observed, and many other factors. Causation would also be a factor. By this I mean, can the employee prove that the infection was caused by exposure at work versus exposure at some other location? Another factor would be, was the employee contributorily negligent? Did the employee wear gloves, a mask, wash their hands, wipe down their work area properly and timely, and do all else he or she was supposed to be doing to prevent an infection? And finally, the amount of damages suffered by the employee is always a consideration by a plaintiff and contingent fee attorneys when deciding when to file suit. What amount of money has the employee lost due to being infected? Are there lost wages, uncovered medical expenses, etc.? Is the amount to be recovered worth the time and expense of pursuing the claim? Is ultimately the calculus that the plaintiff and his or her attorney would have to go through in evaluating such a claim. The final question I want to address is whether an employer can test employees for symptoms associated with the COVID-19 virus. The Americans with Disabilities Act prohibits employers from making disability-related inquiries unless the inquiry is job-related and consistent with business necessity or the employer has a reasonable belief that the employee poses a quote-unquote direct threat to the health and safety of others, which cannot be eliminated or reduced by any reasonable accommodation. The EEOC has issued guidance which addresses that the determination of a direct threat depends on the severity of the illness in question. The World Health Organization has declared the outbreak a global pandemic, and President Trump has declared a national emergency. Given this, it is likely that the direct threat element would be satisfied with respect to the COVID-19 virus. As a result, employers should be entitled to take employees' temperatures at work without violating the Americans with Disabilities Act. However, remember, not all affected individuals present with a fever, so this measure may not be effective and could result in increased panic and fear amongst your employees. You must also keep in mind, again, that all medical information learned about an employee must be kept confidential by the employer. This includes information relating to employee testing for the COVID-19 virus and an employee's reasonable accommodation request for COVID-19 treatment. Lastly, if an employer chooses to implement any COVID-19 related precautions, they should ensure that they are implementing them in a non-discriminatory manner. For example, employers cannot implement measures that specifically apply to all pregnant employees or employees over a certain age. Failure to conduct a COVID-19 response in a non-discriminatory manner could result in a violation of several anti-discrimination laws, including Title VII of the Civil Rights Act. These same principles apply to changes you might be contemplating making to your work rules or conditions of employment. For example, you may be considering requiring employees to self-quarantine for 14 days without pay before returning to work after a trip out of the country. You might also be considering forcing an employee who you know is caring for a COVID-19 relative to take a leave of absence for a self-quarantine period without pay. No official guidance has been issued stating that as of now, but it is hard to imagine that these employees under these circumstances would not be a direct threat to others, such that if the work rules or conditions of employment are not applied in a discriminatory manner, they will not subject you to liability. I've kept one eye on the questions as I've been speaking here. I think I've addressed many of the ones that are there. To the extent we've missed any, we'll save those for the end. I'll turn it over to Craig, I believe, is next.
Hello, everybody, and good evening tonight. I want to start with just a couple of public service announcements, or I guess, for lack of a better word. Number one, there's no way that I'm going to be able to get through all the insurance-related issues in the next 15 minutes or so. So I will be committing to having a full-blown insurance-related webinar sometime early next week. And also, if you want to follow along with some of this information, it is posted on our website, mdaprograms.com. So you don't have to take notes. Some of this stuff will be there, and particularly the non-health insurance stuff, mdaprograms.com landing page. So what I want to do is go through the various insurances and how they might respond to the COVID-19 situation. And I want to first say that I'm just going to give you some general concepts and information. And bottom line is there's some insurances that are likely to respond and some that are not. But the only way to really know if you have insurance coverage or not is to file a claim. So whatever I say tonight, I don't want in any way or shape or form for anyone to be discouraged from filing a claim. If you have any doubts if you have coverage or not, file a claim. Let the insurance carrier figure it out for you. But the bottom line is there's two basic types of insurance out there in the world. One is property casualty insurance, and one is life and health insurance. And in the case of property and casualty insurance, in general, there's not likely to be a lot of coverage, whereas in the life, health, and disability insurance world is where you are going to find your coronavirus coverage. So just starting with the property casualty insurance, those are things like professional liability, general liability, your practice property, and even auto and homeowners insurance. All of those types of policies quite typically have exclusions in them for pandemics, viruses, bacteria. They word it differently, but they typically all have exclusions in them. So there's typically not going to be coverage. Again, the only way to really know is to file a claim, but you're not likely, I don't want to set false hopes for people. There's not likely to be coverage. If you'd like to file a claim, if you're insured with us, by all means, we do that for you. And I'm sure your agent, if you're not insured with us, also would. Specifically in regards to business interruption insurance, which is part of your practice property insurance, we've been having inquiries if that might kick in. And practice property insurance, just like it kind of says in the name, is for your property, your business, your office. And so those policies require direct physical damage to your premises. Those are business interruption coverages for things like tornadoes, fires, your building is or your practice cannot be used any longer. That's where business interruption is typically going to kick in. So there's two layers of reasons why you're not likely to get a business interruption claim. They're going to have those exclusions on pandemics and bacteria. They're also clearly state the coverage is designed for damage to your premises. So not likely to find coverage in those areas, but don't want to discourage anybody ever from filing a claim and letting the insurance company figure that out for us. Having said that, the good news is in the life, health, disability world is where you are likely to find different coverages. In general, with life and disability insurance, you're not going to see any coronavirus-related exclusions, which means the claims are going to go through the normal claim process. You file it, and you need to be disabled or unable to work. So in this case, you would have to actually have the coronavirus, not just have your practice shut down for other reasons. But if you're disabled, unable to work for some reason, that's where something like your disability insurance might be able to kick in. If someone unfortunately passed away from this, your life insurance also potentially kicks in there. I always file the claims on those and get the determination from the carrier. With specifically business overhead insurance, so that's an insurance that is designed to kick in to help pay business expenses if the insured, which is typically you, the dentist, the owner, is, again, it's a disability trigger. So business overhead is not going to pay claims just because your office was shut down by a government edict or something, but it would pay claims if you, the dentist, was disabled, or you file the claim and they determine that you're disabled and unable to practice, then that's where a business overhead policy could potentially kick in. So again, I can't commit yes or no on those policies. You have to file the claim and find out, but there's likely to be coverage in those different scenarios in some way, shape, or form if you're deemed to be disabled or unable to practice due to the COVID virus. Other lines of accident and health insurance, the AFLAC type programs, the different things like that, I would encourage everybody to file those claims. There's all kinds of different fine print in those policies. Some may have coverage, some may not. Go ahead and file those claims. You might have a sickness or accident policy, cancer policies, different things. I'm not going to tell you not to try. File the claim, see what the insurance company has to say. And sometimes you may have coverage, sometimes you not, depending on the type of policy that you bought. So that kind of brings me to the toughest subject, which is why we would have to have another seminar sometime, which is health insurance. And health insurance gets really complex really quick because of the two types of insurance that are out there. There's individual insurance, which actually is not that complicated. Those are your Affordable Care Act, your Obamacare policies, the individual coverage that you buy on the federal exchange. And those are designed for people that can't get coverage through work. So those policies are going to continue on just the way they are currently. As long as people pay their premiums, they're going to have coverage in the individual market. And as well, the individual market could be a landing point for people in the more complex environment, which is people who get their insurance through their employer. So if people are insured in fully insured programs with Blue Cross Blue Shield or Aetna or whatnot, those are employer group plans. And if you're insured in the MDA health plan, that is also employer group plans. So those are employer provided coverages, and they do have requirements in them that people are employed. And so that whole subject of discussion that Jody started out with on filing for unemployment and whatnot, you want to enter that zone cautiously, because as part of getting approved for unemployment, you could be simultaneously becoming ineligible for your group insurance policy because you're no longer working. Now, having said that, it's very unclear out there in the fully insured world how they're going to handle it. A couple of my staff members sat on a Blue Cross Blue Shield webinar today, and they basically punted on this idea of laying off your employees and what's going to happen to them. They're still investigating what they can do. Typically, what would happen when someone leaves employment is if you have 20 or more employees, they're offered COBRA. If you have less than 20 employees, they would have to go to the individual market. Those would be their two options, or get coverage from a different employer at some point in time. So most dental offices don't have 20 or more employees, so COBRA is not an option. So the way the world is right now, the option again would be that individual market. But Blue Cross Blue Shield, I got a sense today, was working on maybe some workarounds in this unusual circumstances to not have people lose their coverage. But at this point, I don't have any further information on that. We're waiting to hear from Blue Cross Blue Shield on that. I do have some good news, though, for those of you who are enrolled in the MDA health plan. Because it's our own plan with the MDA, and it's what's called a self-insured or self-funded plan, we do have some capacity and some flexibility. We have to follow federal and state rules on a lot of things, but we have some flexibility and ability to make our own rules on some other things. And the MDA Health Plan Board did have an emergency meeting this afternoon, and several things, I think very noteworthy things for the members who were enrolled in the program, were accomplished at that meeting. And one of the reasons why the MDA health plan is really a true member benefit. So first thing they did is all coronavirus testing to see if you have it is going to be covered with no co-pays, no deductibles. And that's something actually that you're going to see, I think a lot of the commercial carriers, if you're with the Blue Cross as the priorities at Aetna's, you're going to see that same thing coming from them. That's something that there a lot have matched already, and some I'm sure will very shortly. In addition, we want to encourage people to use virtual visits instead of either spreading the virus if you think you have it by going to a doctor office or ER, or if you don't think you have it but you have something else, or one of your kids has a rash or pink eye or something. We want to encourage virtual visits. They're readily available both with the Blue Cross programs and with our MDA health plan. And so we're going to waive copays on those as well. So if you're feeling like you need a coronavirus test, you can do that virtually now, visit a doctor virtually. And if it's something unrelated to coronavirus, but you just don't want to go to the doctor's office, you can also do that virtually now with no copay in the MDA health plan. And I believe you're going to see some of the other carriers following suit in the fully insured market as well on those two items. So the no copay for the testing and no copay for virtual visits. Having said that, the MDA health plan is able to do a couple things that the commercial carriers are not going to be able to do. And the board voted on 3 pretty significant amendments to the plan that I think are going to be really helpful to people as they fight their way through this. So the first thing that they did, and again, it connects back to the Family Leave Act that Jody mentioned earlier that has now passed the Senate and is expected to be signed by President Trump. And that's going to allow people to potentially get some weekly income if they're home for various reasons. And in the old world, that wasn't necessarily something where someone could stay on the health plan while they were on different types of leave like that. And so this afternoon, the health plan board amended our plan documents so that anybody who is on any type of leave, whether it's the family medical care leave, whether it's paid leave, or whether for some reason unpaid leave, but they would just want to keep their health insurance in place, they would rather take unpaid leave than apply for unemployment, for instance, in order to maintain their health insurance. We're going to allow those people on any form of leave of absence to stay in the health plan. So in the old world, they would have had to go on to the individual market. Now, if you are insured in the MDA health plan, if you've came to the seminars that we do around the state over the years, you do, I'm sure, know that because we're looked at as one big group in the MDA health plan, we have 4,000 people in it. We're way over the COBRA limit of 20. So people who are insured in the MDA health plan will be offered COBRA for sure if they lose their employment by a layoff or whatnot. So they will be able to maintain their coverage that way. But we wanted to give other options to practices. So a layoff, they can be offered COBRA, or they can also look at the individual Affordable Care Act market. If they're not laid off, if they're on leave, whether it's family leave, paid leave, or unpaid leave, we're going to allow them to stay in the plan as long as they pay their premium. So we're trying to do everything we can to help people keep their coverage during these trying times. Another thing that we did is this afternoon is the way the plan is currently set up is employers, as they signed up into the plan, had an option, and when you fill out your plan paperwork every year, you get to change that option if you want to. You could either have your employees' coverage end the day they terminated employment with you, or at the end of the month that they terminated with you. And we know that some people actually started laying people off yesterday. And we know that the end of the month is only a few short days away. And again, with the idea that we want to help people find coverage. If they're not able to stay in the MDA health plan for some reason, you just have to lay them off and they don't fit into these leaves of absence, or they need to apply for unemployment. We want to give them some time to get another health plan in place. So what the board was also able to do that commercial carriers are not going to be able to do is we've extended or given all of our employers who are in the MDA health plan are going to have the option to allow those people to stay on. And I want to make sure I get the wording here right, so I'm going to read it. It's the last day of the second calendar month following the date of termination. So what that means is if people were laid off yesterday, they would have lost their coverage either yesterday or on March 30th, depending on what you selected when you filled out your paperwork this year. We're going to give you the option to let them stay on the plan all the way to the end of April, even if they are no longer your employee, even if they filed for unemployment. So what we want to do is give time for people to find other coverage, either get an individual Affordable Care Act policy, sign up for COBRA with us. We don't want to just be taking people's insurance right out from under them right when this is going on. And I can't make that guarantee that that won't happen in the commercial market, but that's the things that your MDA health plan board has been able to accomplish today on behalf of the membership. So if they need to, they can stay on till the end of April, and leaves of absence, whether they're paid, unpaid, or the Family Leave Act, they can also stay on the plan while they're on any of those types of things, if that's what they desire to do. Now, what that does do is it leaves the problem, though, of paying premiums. So it's great you can stay on till the end of April, but I don't have a job anymore, and how am I going to pay premiums? So recall, if you're in the MDA health plan, we do have to get just one check from you, the employer. And so to the extent that any of you are asking your employees to contribute to their health insurance premiums, which I know many, many people are, It's really your call on how you want to collect that money. You know, you're probably payroll deducting it right now, but you're sitting there thinking, hey, I'm not going to have any payroll deducted out of. If you want to, you know, quote unquote, loan that money and get it from them when they come back to work, you can do that. If you want to have them write you a separate check if they're interested in keeping their insurance so that you can make the one payment, you can do that. You know, various different options like that in order for you to pay the premium. Now, what the board did today that I was most excited about and most thrilled about, and something that's only going to happen with the MDA health plan because of our self-insured nature, is they voted to reduce the April premium payments by 50%. So in other words, we are going to cut the health insurance premiums in half. Whatever your normal premium is, whatever your employee's normal premium is, it's going to be half that amount for the month of April. So you folks all have March covered. You've already paid your premium or you've already been canceled. But for April, we're going to cut the premiums in half. Now, the April bill already went out with the full premium on it. So if you happen to already paid the full premium, you'll be credited half of that back on your next bill. And if you haven't paid your premium, we're working on getting this messaging out. Please don't everybody call tomorrow and ask how it's going to work. Let us get a day under our belts to get this together on how it's going to work. We're going to get this information out to everybody. We'll get you a new bill for the right amount. But we wanted to do something special to help people through this crisis. And this was what the health plan board came up with. So we're real excited about that. And as I said, we will be getting an announcement out about that very shortly. I also mentioned we're going to have a webinar fully dedicated to insurance where we can get into these details and these issues in much greater detail. It should be early next week. So if you're interested in that, look for that as well. With that, we'll turn it over to Ted Schuman on finances, sir.
There has been a tremendous amount of information that's been shared this evening, and I'm just going to share hopefully a couple of nuggets as it relates to some finance considerations, personal finance, and some practice stuff, as well as a couple of points about some tax relief, or I should say relief in paying taxes that we're going to get. Before I get into that, I would like to just give a lot of applause and a lot of recognition to Michigan Dental Association for putting this webinar together. In my opinion, we are in some uncharted waters, so to speak, in a lot of different ways. And one of the things that I've been talking to my clients about is, in a situation like this, there's no such thing as over communication. We're seeing new developments from a legislative standpoint and from an executive standpoint every day, and I think that the topics here are exceptionally relevant and actionable for everybody here. So I just want to take a minute and recognize the MDA's efforts on that. To that end, that communication idea also extends, I think, to all of us as it relates to practice owners interfacing with their employees. We've got some different things going on. It is definitely not business as usual, and there's certainly a lot of hysteria going on all around us. As employers, business people, I think our employees and a lot of the communities at large depend on us to be the voice of reason, be a bit of a calming force to help diffuse some of that hysteria. And I encourage you all to embrace that role in your practices, in your communities, so that we can all get through this. We're all in this together, and hopefully we're all going to come out the other side sooner rather than later. Now, going over to the financial piece of this presentation, the first thing that I want to mention is that we are in an environment where cash is going to be king. Typically, we recommend that clients maintain an emergency fund on their personal side. That emergency fund would be 3 to 6 months worth of living expenses that they can keep in the household. And we're at a point where we're at a point where we're probably going to have to start tapping that emergency fund sooner rather than later because of the interruption in practice, in practice revenue. Now, some of you may not maintain an emergency fund in the practice, and in this case, some of you instead may proxy that to a line of credit. Line of credit, as you know, is sort of an on-demand loan that you can typically access through lenders that you work with, and draw it for cash needs of the practice. I'm recommending that clients start getting in touch with the bankers and the lenders that they work with to start making draws on these lines of credit, even if they don't think they're going to need them immediately. We're in a situation that's rapidly changing. I would say changing by the day, but even changing by the moment. And we're not entirely sure, from day to day what's going to be happening. And so you will be best served if you have ready access to cash. If you are working with a lender, make sure that you get in touch with them, let them know what's going on. I would recommend that if at all possible, tap a line of credit for at least 30 days worth of the operating expenses that you will still incur, even if your practice isn't operating on a normal basis. There are fixed costs in your practice that you're going to encounter month to month, and you want to make sure that those can be covered. Line of credit is a great way to do that. I know that Bank of America is establishing programs for payroll loans and working capital. Bank of America, of course, one of the other endorsed vendors of the Michigan Dental Association. They're working to develop some short-term financing offerings for MDA members. I would strongly encourage you to explore those, particularly if you're a Bank of America client. I've been chatting with some of the Academy of Dental CPA members across the country, and one of the few bright spots in this whole COVID-19 situation is that lenders they're ready and they're getting creative to have financing solutions available to their dental clients. And there's no such thing as too soon to reach out to these people, reach out to these lenders to access what you might be able to need, or modify loans, make draws on lines of credit, or what have you. Like I said, cash is going to be king. From an operating perspective, you may also consider how you're handling accounts receivable and accounts payable. Now, that's finance geek speak for how you handle money that comes in your practice relative to how you handle paying invoices. I know a lot of dentists like to operate their practice with very quick turnaround in terms of paying invoices. We may find ourselves in a situation where someone who would typically pay an invoice as soon as it came through the door would maybe consider taking a little bit longer to pay it if they had 30 days to pay it, as opposed to paying it the day it's received. Maybe take it out to that 30-day mark. Still want to stay current, of course. Do whatever you need to do to stay current. But if you need to help ease a little bit of cash flow burden, you may need to find yourself stretching some of those payments out a little bit longer than you typically would. A couple of other interesting things happening a little bit more at the federal level that I think bear consideration would be there has been a waiver, or I should say a short break for interest accrual on federal student loans. I think some of you probably saw that announcement made a couple of weeks ago, last week I think it was. A little bit more timely, the IRS has decided to allow for a delay in the time that we would ordinarily be paying taxes. In our office, we're right in the heart of tax season right now. We all know that April 15th deadline is right around the corner. The IRS has granted a penalty-free 90-day extension to pay federal income tax that would typically be due on April 15th. So instead of having to pay taxes by April 15th, you can actually stretch that out until July 15th if you want to. Keep in mind that is an extension to pay the tax, not an extension to file the tax return. Now, you can still extend your tax return filing until October 15th if you so choose, but you have an extra 90 days to come up with the cash to pay any tax due. And you can do that without interest and without penalties that you would typically see in a delay of payment of that type. So keep that in mind. I want to talk a little bit about what this could potentially mean to employees that do find themselves laid off as it relates to maybe some accounts that they've built up in the practice retirement plan. I've done some research and found out that if an employee is laid off from the practice, a layoff does not count as a formal termination, and thus if you have a 401k plan, for example, employees are not able to take 401k distributions during the time, during the duration of their layoff. So keep that in mind as well. They actually have to be formally terminated with the expectation that they are not going to return to the employment of the practice. There is a little bit of legislation floating around right now. It has not been formalized. That legislation would be to ease a little bit of that restriction, allow people to access money in their 401k, sort of looking at this COVID-19 situation as something more resembling a disaster and getting a little bit of flexibility in terms of accessing funds and retirement plans, increasing the amount of money they could take in a 401k loan, things of that sort. While I don't recommend 401k loans as a general rule, we do find ourselves in a point in time where we have to do what we have to do, or we may find that we have to do what we have to do. And so we could look at that as being an option. Right now, 401k loans are limited to $50,000 or 50% of the participant's account balance. There's some legislation floating around right now wherein they may actually increase that limit to $100,000, sort of in the midst of the COVID-19 pandemic, and so that might help employees as well as employers access a little bit of cash to bridge us through the COVID-19 pandemic. So a little bit about what's going on from that standpoint. I do have a couple of slides that I want to share with the group as it relates to what's going on in capital markets. And I'm going to try to put this on slideshow so that we can get a full view here. I think you can all see me to the right. We have seen in the stock market, we have certainly seen unprecedented volatility in a very short period of time. The joke around our office is that since about the middle of February, our 401ks have rapidly turned into 201ks. And that's happened in a very short period of time. Markets down approximately 25% through the end of trading today, maybe a little bit more. We have seen pandemics of this nature before, and that's what I'm sharing with you on the slide right now. And we have just a little bit of information about various health pandemics that have happened historically, what happened as it relates to the pandemic, and stock market performance 6 months after the pandemic hit, and then 12 months after the pandemic hit. And we can all look back, and most of us as investors can think back and recognize some of these names like Zika, like Ebola, like MERS, like SARS. SARS being the one that is most similar to COVID-19. At least that's sort of what it's being considered to be. In the short term, market is going to continue to be volatile. Long term, we're expecting that it's going to be okay. I have another slide up in front of the group right now, and that sort of shows various stock market downturns, whether or not those were accompanied by economic recession, and then how bad the downturn was as characterized by a bear market, and then how good the rebound was on the other side as characterized by a bull market. One of the things that's most concerning about COVID-19 is more than stock market response, which of course can be very volatile on a day-to-day basis, is of course the overall economic consequences of COVID-19. Now, most of us are taking the position that we're going to see very, very ugly economic contraction in the first quarter of 2020, probably spanning into the second quarter of 2020, and hopefully seeing some rebound in the third and the fourth quarter. The idea, of course, is that Americans are not able to spend money on all that much right now, and that's creating some economic uncertainty, to put it mildly. One of the things I have to applaud lawmakers for, both on the both in terms of monetary policy as well as fiscal policy would be concerned, is that they seem to be committed to getting out in front of the economic consequences of COVID-19 to any extent that they can. Most of us have seen the Federal Reserve cut interest rates in an emergency session last week, about a week and a half ago now. In addition to that, there's a rumor that there's going to be some stimulus checks issued. I don't know if that's been formalized yet or not. Banks are committed to continuing to lend, and all those things contribute to hopefully stabilizing the economy, either staving off recession or committing to a shallow recessionary environment if we do find ourselves there. So while it may look bleak right now, especially in the midst of all the not only economic uncertainty, but not only macroeconomic uncertainty, but microeconomic uncertainty. Macroeconomic, of course, being what's going on overall, and then microeconomic, of course, what's going on in our individual businesses. There are some good things. There are some positives that we're going to hopefully lean on to get us through this. I'm going to share just one more slide with the group, and that is, of course, the power of staying invested. When you see the market enter free fall like it has over the last couple of weeks, and then today, of course, a very ugly day in the stock market again, sometimes it's very tempting to act on emotion and make some questionable investment decisions that we wouldn't ordinarily make if we weren't maybe panicking a little bit. And just as a quick reminder about what that can cost you, this graph shows the investment performance of $10,000 invested in the U.S. stock market the first of the year, 2009, and then where it would have been at the end of the year 2018. $1,000 invested first of the year 2009 would be worth about $2,700 as of the end of 18. If you miss just the best 10 days, that $2,700 would be down to $1,700. If you miss the best 20 days, that $1,000 would be worth $1,200, and missing the best 30 or 40 days means that investor would have experienced a loss when everybody else would have made money over the course of that period of time. So, as difficult as it may be to ignore what's going on in capital markets day to day, as difficult as it might be to have faith that this too shall pass, this too shall pass. So I'm going to go ahead and stop my part of the presentation there. I know that we have well over 100 questions being submitted on the Q&A, so I'm going to yield my time to the Q&A section of the presentation here.
Thank you, Ted. Thanks, everybody. This has been a ton of information, and as Mr. Schuman has said, we have 183 open questions. So let's start at the top. Just kidding. We have some very common questions that multiple people have said for Jody on the HR front. The questions, Jody, I don't know if you've seen them, but it's like, what about part-timers? Are they eligible for unemployment? What about me? I'm an employee, I'm a doc, but I'm an employee of my company, my practice. So can I be eligible? And then similar questions about benefits. So for example, can I make people take vacation time, or can I forbid them from taking vacation time? We've seen the flip side of both of that question.
Okay, let me answer a couple of those here. The first, can a part-time employee file unemployment? Remember, your eligibility for a claim is determined by the unemployment insurance agency, and the first thing they're going to do is look at total earnings over the last 4 completed calendar quarters. And it's not just earnings from your practice. So whether they were part-time with you and part-time with another practice, all those earnings get lumped together to determine eligibility. Or if it's a brand new employee to your practice, but they worked at another practice before coming to yours, the earnings from that prior practice, if they worked there in the previous 4 calendar quarters, would get counted in that mathematical equation to determine eligibility. And then from there, if they're determined to be eligible, then unemployment determines the split. In other words, if there's more than one employer that's being counted for the sake of those earnings totals, then perhaps more than one employer is going to be on the hook to pay a portion of those unemployment benefits, unless said employer can prove a disqualifying reason to the contrary. So you could, if you have a new employee, for example, they quit their prior practice to come work for you. They've only been with you a short period of time. They may still qualify for benefits because they earned enough with both of you combined to qualify. But that prior employer is going to say, look, I shouldn't be on the hook for any of this because they quit to go work for this other person. So all of that liability then potentially shifts to the current employer who's now just laid them off through no fault of their own. So this is all, it's not based on an hours amount. It's not based on how long they've been with your practice. It's based on how much they've earned collectively over the last 4 completed calendar quarters. And from there, that starts the ball rolling. Another question, can a dentist apply if they are an employee of their own practice? I've gotten this question today 3 or 4 times, and I've actually got inquiries into both the Employer Management Association through SBAM and also through UIA to get clarification on this. So I'm going to hedge that one for now, but as soon as I find the answer, Karen, I will share it, and then we can share it with all of the participants. Another question we're getting a lot has to do with these benefits that an employer might have that an employee could draw from. So, for example, paid time off banks. Maybe you have, maybe you offer your employees paid holidays. Maybe you offer them paid time off. You call it PTO, you call it sick, you call it vacation. Can you have an employee draw from those banks first before going to the unemployment system? Generally speaking, if you are less than 50 employees, and this is sort of aside from the legislation that the feds are looking to pass right now, but up until the president signs that new piece of legislation, prior to that, if you had less than 50 employees, you were under no obligation to offer paid leave of any kind to your employees. And I just say that because if you chose to do so, and most practices do, to look out for their staff and to be competitive, if you choose to do so, you get to write the rules about how much and who gets to earn it and how they have to take it. And so in this scenario, you could potentially tell your staff, look, we're going to have you pull all or a portion of available paid time off banks to keep you whole for as long as possible. And to Craig's point, to keep you on our insurance plan as long as possible. And then after that's exhausted, then, if you're still out of work or we're still shut down or we still can't offer you the hours, then you could go ahead and file for unemployment. I've gotten questions about, if somebody's already filed, but again, we're trying to give them a little extra throughout this time because unemployment is going to pay no more than $362 a week, which is nothing. Can we do that? You got to be careful because remember, anything that employee gets, whether it's in the form of a payout for a PTO bank, a last paycheck that just hasn't, because you pay every 2 weeks, so it just hasn't come through yet, or you call them in for that emergency visit and they're going to get a few hours that week. Any earnings that they receive have to be reported to the unemployment insurance agency when they call to claim benefits for that period. So for that week, if they're getting additional supplemental payments from you, the practice owner, out of the kindness of your heart or because it's wages owed, that could throw off what they get in unemployment for that week. It won't necessarily negate their eligibility for unemployment for the next week, but for the week in which they receive those wages, it could affect the payment that they get that week or forego it altogether because the wages were more than 1.5 times the weekly benefit amount. So a lot of moving pieces here. And And what I'll do too, and Craig had kind of mentioned he was going to put together an FAQ on the insurance side. Karen, I've started putting that together and sending it out to my clients and contacts, but certainly with 1,300 folks listening to this webinar, not all of them have probably seen that. So what I will do is put together an FAQ in regards specifically to unemployment, because that's what a lot of these questions are related to. And you can share that with all participants in addition to the slides that I showed at the start.
That will be great. Thank you so much, Jody. We did have a couple of other questions, and we still have a few more minutes. So I just wanted to ask for Dan Schulte. There was questions about waivers. One person said, should I have anyone who comes in for treatment sign like a consent form that they understand that they're at risk for the coronavirus on top of whatever my usual waiver is? And then the other one says, can I make my employees or ask my employees to sign a waiver that says that they won't hold me responsible if they become infected while working in my office? So 2 questions on the waiver issue.
Well, there's no legal reason why you could not ask an employee or a patient to sign such a waiver. The real question is, once you have it, assuming somebody signs it, will it be enforceable in the event the patient or the employee becomes infected? And that'll depend on the facts and circumstances surrounding the event at the time it was signed, whether it was in consideration for further employment, for example, if that's possible, and other factors. I mean, it would just remain to be seen whether such a thing would be enforceable.
So basically what I'm hearing is you can do it, but might not help you.
Correct. And you won't know until you know.
So then I have another question here for Ted. Ted, a number of people asked, you mentioned the deferral of paying your taxes, and we had people who said, well, what about my quarterly estimated taxes? Will that be deferred as well? So wondered if you happen to know the answer to that question.
Okay, so the question of whether or not the deferral in taxes owed also applies to, I'm assuming, quarterly estimates for 2020. The answer is not at this time. At this point in time, the extension to pay your income taxes only applies to income tax that's owed for tax year 2019. At this point in time, all quarterly estimate payments, actually starting, of course, on April 15th, for those of us that are used to paying them, are still due in April, in June, in September, and of course in December or January, depending on when you choose to pay the fourth quarter. So no relief on that yet, just relief for tax due for the 2019 tax year.
Karen, I'm getting quite a few business overhead questions. Could I address that, please?
I actually had that next on my list. Please feel.
Great. So I might have skimmed by it a little too fast. There's 2 types of coverages that people get confused: business overhead insurance and business interruption or practice interruption insurance. So practice interruption insurance or business interruption insurance is a property casualty product. We discussed that it only triggers when there's direct physical loss to your property. It's your property policy. So it's fires and tornadoes and your property is not in place to have a practice. That's when business interruption kicks in. Where there could very possibly be coverage is on your business overhead. Business overhead is a type of disability insurance. And so the trigger on that is the owner of the policy, which is going to be you, the dentist typically, has to be disabled. So it's not going to trigger again by just these random closures we're having, but it could definitely provide coverage if you contact the coronavirus or if you're disabled for any other reason and not able to practice. So business overhead is a type of insurance that could come into play here, and I would encourage anybody to file a claim that had any kind of health issues during this that might be considered a disability. Hopefully that answers everybody's questions on those 2.
Thanks, Craig. Well, I just want to, I'm going to ask Dr. Gingrich to close for us, and maybe answer just a couple questions about the MDA that we've seen on the question and answer. But I just want to remind people, we will be posting this recorded webinar on the MDA website. So if you would like to go back and look at it later, or you have someone else that you want to watch, it will be available for you probably by the late afternoon tomorrow. The Friday availability for your clinical questions related to patient protection, safety, and infection control is on ada.org/virus on Friday. And with that, I will say thank you so much for being here. And Dr. Margaret, take it away.
So there was some frequently asked questions. Do you feel that the MDA will be extending their 2-week recommendation to 3 weeks, or what the ADA has recommended? We are reevaluating that, and we actually have a board meeting coming up next week. If that comes out from the CDC, and of course we know that the ADA came out and said 3 weeks, we will adjust our recommendations at that time. I would also like to thank all of our panelists tonight. You have been a great resource for our members, and we cannot thank you enough for giving up your evening on such a busy week. Thank you all, and have a great evening.